Hello everyone, my name is Taif and I'm going to present you my case study Beyond the Pandemic, the impact of COVID-19 on the prevention and control of measles and HIV/AIDS. My case study purpose is to analyze how the global response to COVID-19 pandemic disrupted other communicable diseases like measles prevention and control effort, and to draw lessons for strengthening public health response in future crises. The objectives would be investigate the ways in which COVID-19 mitigation strategies affected measles vaccinations and surveillance program. Evaluate the short and long-term consequences of this disruption on measles outbreak and health outcomes. Identify the key lessons and strategies to enhance resilience in public health system during future global emergencies. In this slide, I'd like to give you some background and context. COVID-19 put a shadow on measles and overwhelmed global health system, diverting resources and attention. Routine immunization programs, including measles vaccinations, were delayed or suspended, resulted in a resurgence of measles outbreak globally, and it reversed the progress in controlling a highly preventable disease. I'm also going to give an overview on health system strain and global implication, and talk about how pandemic exposed gaps in public health infrastructure and emergency preparedness. I'm going to demonstrate need for resilient system capable of handling multiple health threats, and ties into key course theme: disease prevention, system resilience, global health interdependence. And I used measles as a case to highlight a broader impact on communicable disease control. Service disruption during COVID-19. As COVID-19 dominated healthcare priorities, two critical areas, measles prevention and HIV treatment, suffered major setbacks. Immunization programs were paused, leading to new measles outbreak. HIV service saw delays in testing, reduced antiretroviral treatment, ART access, and limited outreach, especially in already outstressed system in low and middle income countries. Barriers to continuity care. Several interconnected challenges deepened the disruption. Resources were rapidly reallocated for COVID-19, coordinations broke down, and public trust eroded. These barriers made it especially difficult for vulnerable population to access care, while government often sidelined long-term disease control for short-term COVID strategies. The pandemic revealed a hard truth. Many health systems lack the resilience to manage multiple crises simultaneously. Essential services like measles vaccination and HIV treatment must be shielded even in emergencies. By strengthening infrastructure, coordinations, and equity in care, we can better prepare for future global health threats. Lessons learned and systematic gaps. Weak systems were overwhelmed by a single crisis. Essential services must be protected during emergencies. Future preparedness requires integrated and equitable planning. In this slide, I'll show some data that shows the vulnerability of HIV during the pandemic. HIV testing in the US decreased by 32% from Q1 to Q2 in 2020. Pre-exposure PrEP prescription declined by 6% during the same period. Both metrics began to recover by Q3 2020, but had not returned to pre-pandemic levels by the end of 2021. So this would be the closing of my case study presentation. And before I close, I'd like to make some recommendation. Key recommendations for building a resilient health system. Prioritize resilient health system to balance emergency response with ongoing diseases prevention. Strengthen coordination to foster better collaboration between government, international organizations, and NGOs. To ensure equity in healthcare, focus on equitable access for marginalized populations. And build trust and combat misinformation. We need to develop communication strategies to reduce vaccines hesitancy and stigma. Also, strengthen political will to commit to long-term global health strategies beyond crises. Key takeaways from today's case study presentation. COVID-19 exposed the fragility of global health system, revealing the cascading impact on other communicable diseases. Disruption in immunization program and HIV treatment highlighted the need for better resource allocation during global health emergencies. Coordination between national governments, international organizations, and NGOs is essential to ensure comprehensive responses to multiple health threats. Marginalized populations faced increased healthcare inequities during the pandemic, underscoring the need for targeted intervention. Misinformation and political polarization around COVID-19 also hindered effort to address other diseases like measles and HIV/AIDS. Strengthening public trust in health system through transparent communication is vital for maintaining effective disease prevention programs. Governments must strike a balance between responding to short-term health crises and committing to long-term health priorities. Building resilient health system with the capacity to respond to multiple health crises simultaneously is crucial for future preparedness. I would like to thank everyone for joining me today. I hope you all have a very wonderful day. Take care.